I entered medical school in 1969, nearly 40 years ago. During my lifetime in medicine in the United States of America, we've gained a much better understanding of the scientific causes of disease, how best to address this burden, and as a result, we've seen increased lifespan. But is that the entire story? A recent study by Dr. Majid Izadi and colleagues at Harvard of health statistics county by county across America from 1961 to 1999 suggests not. Here's what they found. Overall, U.S. life expectancy increased from 67 to 74 years of age for men and from 74 to 80 years in women. Between 1961 and 1983, the death rate fell in both men and women relatively evenly across America, mainly the result of reductions in deaths from heart disease and stroke. In the early 1980s, this trend reversed itself in some of the counties across the nation. In the poorer counties, death rates began to increase, especially in women, a shift that researchers call the reversal of fortunes. Why? The culprit appears to have been a reduction of deaths from cardiovascular disease and some increase in disease burden from lung cancer, chronic lung disease, and diabetes in both men and women, as well as a rise in HIV/AIDS and homicides in men. Of the 3,141 counties measured between 1983 and 1999, 30% of the counties showed a reversal of positive trends for women, and 2% of the counties showed a negative trend in men. Those counties that declined showed a positive correlation with lower socioeconomic conditions. Stagnation or increase in mortality was notable among the poorest segments of the population, affecting 4% of the poor male population and 19% of the poor female population. Putting it all together, the gap in health between poor and rich in America initially narrowed and then widened. This newest report documents what global and national public health experts have been stating about American healthcare for over a decade. In 1999, the U.S. healthcare system got a shot across the bow by the World Health Organization. The WHO had been fast at work on comparative studies of national health systems, and the study ranked us a dismal 37th, primarily because we scored comparatively low in distribution of resources and in distribution of financial burden. The report seemed to reveal the issue of feast or famine in U.S. health. The feast? Well, according to a 2002 Institute of Medicine report, Americans today, compared to Americans in 1900, quotes, are healthier, live longer, and enjoy lives that are less likely to be marked by injuries, ill health, or premature death, close quotes. The famine? Well, as stated by health policy experts Stephen Isaacs and Stephen Schroeder in a 2004 New England Journal of Medicine article, quotes, any celebration of these victories must be tempered by the realization that these gains are not shared fairly by all members of our society. Race and class are both independently associated with health status, although it's often difficult to disentangle the individual effects of the two factors, close quotes. A few simple numbers illustrate the point. Whites have a median net worth in the United States at 10 times greater than blacks. While 11% of whites live below the poverty line, 27% of blacks struggle with poverty. The life expectancy of blacks is 7 years less than that of whites. And blacks suffer higher rates of cardiovascular disease, diabetes, hypertension, infant mortalities, homicides, and a variety of cancers. Now, are these differences due primarily to race or to class? Well, it's clear that prejudice and discrimination, the hallmarks of racism, impact the health of minorities in America. But low socioeconomic status, which is often a byproduct of racial discrimination, may be the dominant contributor to poor health. Factors previously associated with low socioeconomic status and poor health include poor nutrition, increased smoking, decreased exercise, increased stress and fear, unsafe neighborhoods with high crime levels, substandard housing, inaccessible and expensive services, environmental hazards, and poor schools. Why is this important now? Well, the Harvard study above dramatically shows us that there are geographical links to health and poverty. With the 2008 election just around the corner and the health care reform front and center, we need to remember John Edwards' emphasis on two Americas. And we need to understand that we will not be able to successfully address health care in America without simultaneously addressing poverty. For Health Commentary, I'm Mike McGee.